Nothing gives our age away more than our eyes, especially as we get older. Reducing the appearance of aging around the eyes can be achieved with an eyelid lift. Dr. Jeffrey Jacobs of the Morrow Institute explains the remarkable transformation that occurs after this procedure is done.
I think eyelid surgery is the single most dramatic surgery that people can have. And what it does is it really dramatically changes the appearance in that they look much more youthful and they don't have the drooping, hanging, crepey appearing eyelids. Because when people speak to each other and interact with each other, that's of course the first thing that people look at is the eyelids. The main goal of surgery of the eyelids is to make sure that the eyelids do their protective function, which is to close and cover the eye. The main problems and complications related to cosmetic surgery of the eyelids are the eyes not closing properly. So when you do surgery of the eyelids, first and foremost, you have to make sure that the function of the eyelids is preserved and then take care of the cosmetic appearance of the eyelids. This woman, if we are going to look at her lower eyelids, the photo on the left before surgery, she has a crepey appearance of the lower eyelids. On the photo on the right, which is the post skin peel, she has a very nice and smooth, youthful appearance of the eyelids. And what she had was a Morrow Institute skin peel, which took up the slack and crepiness of the lower eyelids. From time to time, we at the Morrow Institute do see patients who have had surgery performed elsewhere, and the patients are not happy with the surgery that was performed. And as you see on this patient, on the photo on the left, which is after having had her eyelids done elsewhere, what happened is the eyelids became pulled down. And what that actually does is to make the eye more irritated, and it can cause blurry vision. This is the result of removing too much skin of the eyelids by cutting it out surgically. What we can do, and the photo on the right is post-op after we did surgery on her, is to restore the normal appearance and function of the lower eyelids. This very nice woman came to us having had surgery of her upper eyelids performed elsewhere. She came to us saying that she did not appear as though she felt inside. She appeared angry and stern. And if you look at the photo on the left, the preoperative photo at the Morrow Institute, after she had had her upper eyelid skin taken out somewhere else, what it effectively did was pull the eyebrows down. What we did, the approach we did, was not to do any more surgery on the upper eyelids, but rather we performed an upper facelift where the forehead and eyebrows were elevated, and the difference in appearance preoperatively on the left and post-operatively on the right are night and day. This woman looks like a much more pleasant, calm woman that you would like to speak to. And as you can see, eyelid surgery is not just for women, it's also for men. This gentleman's lower eyelid on the left appear to be baggy and he looks sad. And on the right, his lower eyelids are nice and smooth. What he had was, we approached the eyelid by taking the fat out from the inside surface, so he has no skin incisions on his lower eyelids, and then to smooth out the wrinkles and crepies, he had a skin peel, which took up the crepiness of the skin, and it gives a much more youthful appearance to the lower eyelid.